Hey guys, how you doing? I'm Darren Cornett. I'm the COPD guy. I hope you enjoy this channel. This channel was actually designed and dedicated for people who were diagnosed with COPD and they want to learn more about it because it's a life-changing disease that you got, and I want to make sure that you know about it and how to treat it and how to function with it as best you can. So this introductory video is to tell you a little bit about me and then a little bit about the series of videos that you're going to be seeing coming out on this channel. First of all, my name again is Darren Cornett. I'm a registered respiratory therapist. I've been a therapist for about 35 years now. My experience level is I worked with neonates, the tiniest of little babies, all the way. Then I went to pediatric ICU where I worked with infants all the way to 18-year-olds. Then I worked with adults. Then I went out into the sales field and I sold equipment for a while. And I was a clinical specialist for the Southeast for about 14 different states for a company. And then I came back and I was the director of respiratory care at a facility. And in 2014, I really got interested in the COPD population because I was a director at that time, and nationwide we saw COPD readmission rates anywhere between 22 and 26%. And what that means is that after a person who had COPD, chronic obstructive pulmonary disease, was discharged from a hospital, they were readmitted within 30 days, 22 to 28% of the time. That's a lot. So we started thinking, how can we fix this? How can we make this better for our patients so we're not seeing them all the time coming in through the emergency room and that sort of thing? So my department, we created chronic lung navigators. We was the first in the entire corporation to do that, and we had tremendous success. From 2014 to 2016, we actually were able to drop our readmission rates from that 22 to 26% down to about 8 or 9%, which is a huge drop. Worked extremely well. So we brought on more chronic lung navigators. The problem was once they got discharged to home, they only remembered things for a short period of time, and there was nothing really being reiterated to them from the home. And today the readmission rates are, guess what? You got it, 22 to 26% nationwide. Some hospitals have better rates because they have chronic lung navigators helping them in the hospital. But a lot of times once they leave the hospital, unless there's a reinforcement on a weekly, monthly, or quarterly basis at the very minimum, there's not going to be adherence that you want to see. So that's what got me interested into the COPD market. That got me interested in wanting to help people, and that's why I created this channel, is so that I can teach you about your disease process and let you make the appropriate decisions instead of having someone always telling you what they're doing and sometimes not even telling you why. So I hope you love the channel. Some of the things that we're going to discuss is going to be, what is COPD? What causes it? What are the risks of having it? How does it diagnosed? What kind of assessments are done to diagnose it? What kind of treatment can I expect to see? What kind of management? How about me living with COPD? How can I live a better life knowing I've got COPD and knowing what stage of COPD I'm in? And then are there any preventive measures that I might be able to take? And then we'll conclude at the end with just a summary of everything that we've talked about. I hope you love the channel. I hope you love some of the videos that we come out with. Thanks, and have a great day.